Hi, I'm Christie Ballantyne. I'm the Chief of Cardiology and Cardiovascular Research at Baylor College of Medicine in Houston, Texas. And it's great to be seeing you from the EAS. We just finished a late-breaking presentation for new clinical trials. This was on the fixed-dose combination of bempedoic acid plus ezetimibe. One of the major themes of this meeting has been, what do we do for the patient who on maximally tolerated statin therapy still has high levels of LDL cholesterol and atherogenic lipoproteins? So that was the focus of this study. For some background, bempedoic acid is an inhibitor of ATP citrate lyase. That is upstream of HMG-CoA reductase, so it's in a similar pathway. The mechanism of action is to increase LDL receptors. Ezetimibe blocks cholesterol synthesis, so there's less delivery of cholesterol to the liver. That also increases LDL receptors, but by a different mechanism. So the hypothesis is if you put these two medicines in a single pill, that might be a convenient approach for giving further reductions in LDL cholesterol and other benefits in patients on maximally tolerated statin therapy who were still having high levels of LDL cholesterol. So the trial was designed with this in purpose. It took people who either had atherosclerotic cardiovascular disease or FH, or there was also a group that had high-risk primary prevention. You had to have a little higher LDL to get in if you were in that group. But it was a mixture of secondary FH and high-risk primary prevention. The baseline LDLs were around 4 millimoles, which is 160 milligrams per deciliter, and the patients were randomized to one of four groups. The fixed-dose combination tablet of the bempedoic acid and ezetimibe, bempedoic acid alone, ezetimibe alone, or placebo. So then it was in a 2-to-1 randomization schema. It was a 12-week study, and the top-line results are that the fixed-dose combination, as compared to placebo, gave a 38% reduction in LDL cholesterol, and that's an absolute reduction of 1.5 millimoles. Baseline LDLs was 4 millimoles. There was an incremental reduction in ApoB of 25%, and that is about 30 milligrams per deciliter. And there was a further reduction in the combination of hsCRP of 35%. 12-week study, so it's a short-term study, but safety and tolerability was quite good in this study. So, and there's also, for those of you following this program, there is also in progress a long-term outcomes trial of 12,000 people, which is well along ways in terms of giving us more information about outcomes. So in summary, the fixed-dose combination, in terms of the patient who on maximally tolerated statin therapy still is not at a good level of LDL, either secondary prevention, FH, or high-risk primary prevention, here is an option, an oral medication, taking one pill once a day, which gives about a 40% reduction in LDL cholesterol on top of maximally tolerated statin therapy.